Okay, well, I started 38 years ago in 1984 when we were still the Exceptional Child Center. I've been through all iterations of the names: Exceptional Child Center, Developmental Center for Handicapped Persons, Center for Persons with Disabilities, and now the Institute for Disability Research Policy and Practice. I started out as the low man on the totem pole as what was then called a senior secretary, part-time, and just kept growing from there. We did research with children who were born extremely low birth weight, children who had intraventricular hemorrhage, children who had autism, who were deaf, blind. We did the full gamut all across the country. When we started, we had sites in New York, New Orleans, Florida, California, Montana, Utah, and we had 16 sites across the country. We were funded by Maternal and Child Health, by HRSA, and I mean, it was big. It was called the Early Intervention Research Institute. It was originally started by Dr. Carl White and Glenn Casto, who was also one of the co-founders of the center when it first started. And they just got this idea to start this big research institute. And that was a 5-year project. And when that was coming to an end, they did a follow-up on that. It was the Early Intervention Follow-Up Institute. And then after that, we had the Early Intervention Effectiveness Institute that were following these children for 16 to 20 years of their life. It's very much a longitudinal study. I think we have expanded more in our expertise. We were more focused when we started on, young kids in separate schools. It was almost segregation type thing, and it was more in-house services that they would bring the children to the center to work on. Whereas now we go out to their homes or out to the communities. We go across the country. We've just really expanded the services that we do. We've expanded our focus. Our focus is no longer just on young children. We cover people through their lifespans, and it's exciting to see what we can do. IDASL stands for Interdisciplinary Disability Awareness and Community Engaged Learning. We learn from various experts in the field of so many different topics. We learn about mental illness, we learn about deafness, we learn about blindness, we learn about technology that is available to individuals with disabilities. I think one of the funnest exercises we have is when I take the students out in wheelchairs, and not so that they can see what it's like to have a disability, because you can't unless you actually have a disability, but to experience some of the barriers that individuals in wheelchairs have. And we're only out for maybe an hour and a half, but I have students who have told me that it was a life-changing experience for them. We've had students who have contacted us 5, 10, 15 years after they're out of the class and say they are still using the information they learned from the class. No matter what occupation you have in life, you are going to encounter individuals with disabilities. Whether it's a client, a colleague, or maybe it's even going to be somebody in your own family, and maybe even yourself. And the more you are aware of what services are available, what their needs are, the more you can help them. One of the wonderful things about working here at the Institute is they don't focus on what you can't do. They find what you can do, and then they work to increase that. And I think that's what they did with me. I started out as basically just a typist, a secretary, but now I'm a coordinator of projects. I am a data coordinator for our national database. I am an editor for our journal that we put out. I take care of developing budgets and submitting proposals. I help write the annuals and final reports. And I mean, my job has totally increased because the people here, they find out what you're good at. And then they increase it. And they do the same way with the clients that they serve. They find out what their clients can do, and they help them increase that amount. They find out what they want to do, and they help them to do it. It's an incredible place to work. This has been 50 years that I've been here for 38 of those 50 years that they have been serving the community and serving families and helping families. And it shows they love the work that they do.